All right. Well, welcome everyone to our webinar on the state of health tech journalism. I'm thrilled to be joined by Eric Wicklund from Health Leaders, Katie Adams from MedCity News, and Aaron Weitzman from Axios. It's obviously a very busy time in healthcare. We just finished JP Morgan. We're going into Vive. We have HIMSS shortly thereafter. So we wanted to use this time to understand what it is that our top journalists are covering. What are the issues they care about? What are the companies that they're paying attention to? And what are the sources that they need to tell their stories? So without further ado, we'll just get right into it. So we have a lot of people on the line today, all who represent or work with in some capacity health tech brands. So I wanted just to start by asking each of you, what are the top technologies that you are interested in today? Like, what are the ones that are really moving the needle for you? Eric, maybe we could start with you.
Okay, sure. In as much as everything seems to be AI these days, there's a lot more to that market. At Health Leaders, I focus on innovation and technology. So yes, AI one, but the whole digital health space, telehealth, digital health, connected health, all the different phrases and terms that are used now. It's all fascinating right now. We just got off CES, so consumer-facing technology is interesting. Basically, what I'm looking for is whatever healthcare executives, hospitals, and health systems are interested in adopting in the clinical space, and that can be a wide range.
And when you say the clinical space, do you mean largely diagnostics, or are you interested in kind of like workflow and operational technologies as well?
Everything within that, anything that a CIO, CEO, CEO would be interested in, and not only in the hospital setting. We're seeing more and more healthcare services going out to the home, to the office, to the everywhere. I hate to use the term wild west because it's been used so much, but it is. It's a very fluid environment right now. So technologies that are not only improving care, access to care, but improving the back office operations that stress out doctors and nurses so much.
Yeah, exactly. Aaron, how about you?
Yeah, I would say there's a lot of cool things going on with medical devices. I've also seen sort of like kind of a blend of like healthcare, consumer retail. There's a lot of those things out there. And like obviously AI is something that everyone's talking about, and we're still very early on as far as that goes, but I think it's going to be a game changer. And like, there are some really good use cases. I think Eric alluded to some of them, some of the administrative back office things. There's a lot of transcription services between patient and doctor, and also a lot of staffing services that are using AI to kind of help with the shortage of workforce, because that's still a really, really big issue in healthcare. And the more we can do to, get doctors practicing at the top of their license, I think the better it will be for everybody.
Yeah. So that actually brings me to the next question. And Katie, maybe you could start by speaking to this. But, I think it's one thing to be interested in a technology, but I think it's really about the story and the value that that technology is delivering to key stakeholders, whether they're health systems or, pharma companies or what have you. Can you talk a little bit about what makes a good story in your eyes? If you're reading a pitch, like what are the things that you're keeping an eye out for?
Similar to what Eric had brought up, I cover a lot of providers, health systems. It's kind of my beat too. So I love to be able to talk to at least, a clinical leader or maybe just a doctor who's using this tool at a health system in practice, or a doctor who's, if it's an earlier stage technology, helping to develop this technology or kind of explain the pain point there. If you take like an area like LLMs or generative AI, where like so much money is being poured into it, and so many startups say that they have like a generative AI or LLM element. Like for instance, clinical documentation is like one of the hottest use cases for that right now. And that space is becoming quite crowded. So, rather than writing about every company that has a tool that ambiently listens, kind of talking to a clinician who really benefited from using that and how it kind of is saving them time in their workday. Like there's so many pieces of technology to alleviate clinical burnout right now, and they
Right.
all claim that they, save clinicians this percentage of time, but that doesn't, really mean anything until I can talk to a doctor who says, I used to spend 4 hours in this, and now I spend only an hour and a half. So
Right.
getting that story of what it looks like in practice,
Yeah.
um, really makes a story worth writing a lot of the time.
So data, customer validation. Eric, is that the same thing for you?
Same thing, really. We focus on the decision makers in healthcare. So, I love talking to vendors. They're people to talk to, but unless it's being used, unless that technology is being used in healthcare now and it's being proven, that's really what's going to hook me is when there are health systems, hospitals, even payers, clinics, whatever, using that that technology, that platform to improve back either administration or back office or clinical care. Um, and yeah, it's hard in this industry because there's so much out there that promises, pledges to do something. You've got to
Yeah.
find you excuse me, you got to find that technology that is really working.
Yeah.
And really, that's what my audience is going to listen, going to look for. Is they're going to look for that the, the the value, the ROI in some.
Right. I guess follow-up question to that, so that all makes complete sense. You want to make sure that the companies that you're covering, are truly moving the needle when it comes to their customer base. That said, are you open to preliminary conversations? Obviously it takes time to amass a large customer base, see impact from the solutions that are being implemented from health systems. Are you open to introductory calls with health tech vendors? And maybe you don't write about them right away, but you have that initial conversation and then you kind of follow them over the course of the next several months, maybe even years. Does that happen, or do you typically hold on any sort of interview until company has seen that momentum among health systems or whoever they sell to?
In theory, I'd like to say yes, I'm open to these, but I feel a little dishonest because I feel like most of the time you don't want to spend time on, an interview that might be 30 minutes for
Yeah,
something that you can't get a story about. When you do have,
right.
daily quotas or deadlines, that gets tough. So in theory, yes, and I feel like a lot of those conversations where I talk to a startup that I don't write about just then, but maybe I reach out for comment a couple of weeks later, I write a story about for a kind of relevant deep dive later on. Those usually tend to happen at conferences where, we're
Hmm.
at the networking event or we stumble upon each other at lunch. So those are valuable and I maybe should be taking more of those, but realistically, I don't take too many of those because I don't want to work late, but
Yeah,
it's not to say there's no value in those.
yeah. How about you, Aaron, Eric? Is it the same for you?
Yeah, I would say it's pretty much the same as Katie. Although like I want to try and, I'm always open to a meeting and having discussions. But like Katie said, it's like the time value and like as
Yeah.
journalists, we always try like to make every call, every meeting, every interview into a story if we can. And I know that's not always feasible, but that's like our goal. And with those kind of early stage where just an idea or, maybe it's not proven ROI. That's a little tougher for us to kind of make, do a talk with them so we don't get a story. So yeah, I would say I'm in the same boat as Katie.
Yeah, me too. I mean, the interviews have to have meaning for them for both sides of the
Right.
conversation. So I focus on the important ones are the interviews. But yes, Vive, Health, HIMSS, ATA, CES, the exhibit halls are fantastic places to find new ideas and technologies there. And it is so much fun to just wander around and
Yeah.
visit with people then. And certainly, in the after hours events, some of the best stories I get out of those after hours events because everybody's
Mm.
more apt to talk about their technology and the ideas, the promises around them.
Yeah.
But and yeah, I'll keep track of as many as I can, but you got to wait until they really gain ground because there are so many vendors out there that you see at Health, Survive, whatever 1 year, that aren't there the next year or the year
Yeah.
after that.
That's interesting. I guess to that point, I think we saw the emergence of a ton of digital health companies, during the COVID years, right? A lot of those companies, as you point out, may not exist anymore, may have been acquired. Let's talk a little bit about the landscape today. I think, the funding environment is certainly very different than it was a few years ago. We're seeing fewer deals, we're seeing smaller deals. We're anticipating an uptick in M&A activity. Aaron, I know this is like totally your sweet spot. This is where you focus. I'd love to hear a little bit from you in terms of, what kind of deals you're most interested in, and the best way for folks to pitch you. I know we talked a little bit earlier about exclusivity, and I think next to your name, there's like exclusive. So I think even starting there would be super interesting.
Yeah, no, totally. So yeah, like you pointed out, the environment has completely changed from 21, 22. Last year was just, funding was hard. I took a lot of meetings with a lot of founders, a lot of CEOs, and the main themes that I guess they told me were one, yes, funding's hard, but the companies that are solving really big problems in innovative, unique, creative ways are getting the funding that they need. I also have seen kind of a more of a onus on profitability. So a lot of CEO and founders are kind of, taking the path to profitability versus growth. And well,
Yeah.
you need to have both in today's world.
Yeah.
They want some more optionality and flexibility. And I think, as far as like exclusivity, that's a big thing for us. We love exclusives, but we don't just take an exclusive just to take it. We try to think about, what problem is it solving? What sector are we covering? How is the technology? Is it something really cool? Is it just something that's been played out before? We try to take all these factors in. And while the money, like the amount of funding doesn't really matter, for us, like we'll cover anything really, like above 100, above 1 million.
Yeah.
But yeah, I think as long as like, we see something that our readers are going to be interested in, that's like kind of the main point for us.
Yeah.
So yeah, I don't know, but there's so much cool stuff out there, and there's a lot of innovative companies, and hopefully this year is a little bit better funding wise and deal wise.
How often do you speak to VCs? Do they often pitch you to get their portfolio companies on their radar, or do you ask to speak with them, especially, related to a funding round?
Yeah, so I would say I do speak to VCs a lot, whether it's
Mhm.
just like getting their thoughts on trends or asking them about new, like that when General Catalyst news broke, I was
Yeah.
asking everyone's opinion on it. Is it something they would do? Why not? Like, what do you think what do you think General Catalyst is gonna get out of this? But yeah, always talking about their portfolio companies, talking about their investments. And I think it's good to kind of pick their brain. That's how I do my best learning, is listening to all these smart investors
Yeah.
who have been in up cycles, down cycles. So yeah, I just really try to ask as many questions as I can, and just kind of, learn from them and soak it all up like a sponge.
Yep. I love that. Is that the same with you, Katie and Eric, or do you lean primarily on health system customers for that third party validation?
I do talk to a lot of VCs, a lot for trend stories about, what digital startups they think are gonna, consolidate the most, which ones are gonna have the hardest time raising funding, trend stories like that. Um, but also just the way MedCity News is as a publication, we won't be really having those exclusives on, M&A deals or funding rounds. We'll just do like a more analysis driven story about it like a couple days later, especially for those M&A deals.
Yep.
So I will reach out to VCs a lot for commentary on, what a big retail company buying another primary care provider means for the industry, or what, mental health platforms consolidating means for the industry. So I more so get their commentary about, what deals mean for,
Mhm.
the economic trends within the digital health industry,
Yeah.
less so why they invested in a particular
That makes
company.
sense. Eric, do you take a similar approach or?
Yeah, I don't talk to VCs that often.
Yep.
I do, it is for trends. But yeah, the market has changed. A lot of, the ROI for a technology is much shorter now. Hospitals, health systems want that value quickly, immediately. They don't want to spend a lot of money and not see value a year or two down the road. So they're really invested, or they're really focused on these proven technologies. These new ideas, new technologies coming about are great, but they've got to shorten the distance between potential and actual
Right.
to work. And also, you're not seeing a lot of the niche technologies, the little small one-stop services now. There's a lot of consolidation in the industry. You're looking for an enterprise-wide platform or technologies that can integrate with other technologies to
Right.
have a much wider range of services or range of value to them.
Right.
That's where it's going right now, just because the money isn't there to spend on some of the more fanciful ideas.
Yeah, I mean, that's a very good point. And I think, again, that's kind of a change that we've seen in the past couple of years. I mean, I think it totally makes sense that there has to be integration and consolidation because, not every single point solution that emerges realistically can be adopted by these health systems. It just takes too long with staff training. It's not worth the ROI. I guess I'm curious about it in the context of all of these AI companies that seem to be emerging and, saying that they can solve for a lot of the issues that are currently plaguing healthcare, such as the imbalanced patient-provider ratio that you mentioned at the top of the call. When it comes to AI companies specifically, and I say this realizing that almost every company is an AI company or poised to be an AI company sometime soon. Like, what interests you the most? Like, how can an AI company kind of break through the noise, and what makes you excited about them? I'm asking because there's so much buzz around it. And I'm curious if you're more interested in the diagnostic aspect of it or the operational benefits of it, or are you just over it?
I'm a little over it, just because, you're inundated with probably a couple pitches for a pretty sizable funding round from an AI startup each week. So I think if I'm getting a little tired of it, my audience probably is. So I try to pick out the ones that are either like really late stage or a lot of money. And
Yeah.
then if it's not that, I'm looking for a differentiated use case. I just covered a startup that is an AI startup that like tries to check providers' clinical bias at the point of care. And
Interesting.
that's, I never really heard about that. That was kind
Yeah.
of cool. There's another, I mean, every startup's kind of AI startup. I don't know if it's AI proper, but it involves sensors and stuff to protect healthcare workers from violence.
Yeah.
Like an interconnected system in the health system, and that involved AI, and that was something I hadn't written or heard much about. So that was something I definitely wanted to cover rather than the 1 millionth solution to like help with note taking or whatever. So
Right.
right
Right.
now, I would say there's a bit of AI fatigue, at least for me. So I'm looking
Yeah.
for companies with a bit more of a differentiated or interesting use case.
Interesting. Aaron and Eric, do you feel the same?
Yeah, it's every company out there that AI is a catchphrase. Well, yeah, we're doing it too. But again, with hospitals, health systems, and so on and so forth, they're looking at all these endpoint solutions. They're saying,
Yeah.
it's ourselves instead of partnering with a vendor that would do the same thing that we'd have to pay money for. Right now, it's an early part of this growth curve that these healthcare organizations are just trying to figure out if they're mature enough to use AI, or if they have to do something more things internally before they can start adopting AI.
Right.
Those they're working with some of the bigger players, the Microsofts, the Googles, and so on, so Intel. They're working through their EHR to launch AI programs. They're
Right.
not looking at the little players right now
Right.
until that base is established, and then they can decide. Okay, now that we've proven value with a few certain low-hanging fruit projects here and there, now we can start looking maybe at some of the ones that are still around by then. That do often unique ideas, unique approaches to using AI to tackle gaps in healthcare.
Yeah.
Right now, it's such an early part of the cycle that it's a lot of experimentation. Really, it's values is hard to prove.
Are you interested or following like regulations and guardrails around the safe and ethical use of AI, or is that something that you're also kind of over to some extent?
I'm interested in knowing who's going to set those guardrails.
Yeah.
We've got the Biden administration's announcement. We've got HHS coming out with something. There was an announcement today of a safe AI committee that is being formed. At the same time, a lot of hospitals and health systems are saying we want to set those guardrails ourselves. We want to, they remember back to the development of EHR and how that was such a mess between what the government wanted with meaningful use and what health systems were being saddled with at the time when they really didn't understand, how to deploy the technology properly. Now we want to have a say. They're forming their own governance committees. They're launching their own programs and they're setting their own guardrails. What happens, will there be some conflict when we finally come up with a set of standards that appeals to everybody within the industry?
Right. Yeah.
Yeah.
I mean, I would imagine potentially, yes. Is that something that Katie or Erin, you're following? Probably Erin less so for you, just given kind of your beat, but Katie, is that something that you're interested in as well?
Yeah, I mean, I'm always trying to see, what's next. And I guess the pace of innovation for me can be a little hard to follow, like being removed, not being a clinician myself and being, I've been like a health tech reporter for a little over 3 years now, and it's still like not, I still don't really understand everything that they say to me in interviews. If anyone on the call has like had me send questions to a client of yours, you see that with almost every other question, if it has to be like a written, I say use as little jargon as possible because sometimes it can still be difficult to separate like just the abstract language of it all with what's real and what actually could move the needle. So yeah, I think that it's definitely something I'm watching too and always trying to stay ahead of.
Yeah. Well,
Yeah.
actually, that's an interesting. Oh, sorry, Erin, go ahead.
I was just gonna say, like, we're trying to I don't know. I get the impression there's a lot of like AI washing out there. So we're trying to like push back and like gently challenge companies to like get into the weeds and explain exactly what their AI is, how they're using it, how it's incorporated, where they're getting their data from. So we really try to kind of get into the nitty-gritty with that because we want to make sure that they're not just saying they're an AI company when they're not really. And I think
Right.
also like it's important like in today's world, like AI can't just be the whole thing. It's got to be like one tool in the toolkit.
Yeah.
And I think also like it's all about data. So the companies that have, really robust, unique data sets that cover a lot of lives, those seems to be the winners as opposed to the
Yep.
smaller data sets.
Yeah. What kind of data like are you most interested in? And then I ask this, I guess, with two things in mind. One is company data in terms of the ROI of its solutions, potentially growth metrics. Like, is that something that you're interested in? And then I'm also interested in terms of like, to what extent are you interested in industry data? So it might be commissioned by a company, but it speaks about the larger market.
Um, I like those reports that survey like C-suites of health systems and ask like leaders what their priorities are, what tech they're actually interested in adopting. Because similar to, having to protect myself from the jargon, if you look at the press release or what the company's saying, they can make it seem like this is a problem that health systems all like have on the top of their priority list when that's not the case, when they're like, oh, that is kind of a pain point, but we're not going to invest in that technology until we get these other problems solved. um And then sometimes, like, I'll cover an announcement from a company, and their press release has like so many stats about the technology. You know, the press release could be 75% statistics about how great the technology is, and I would like barely look at it and definitely not include it in the story because they just look so obviously like promotional, and
Yeah.
if you unpack them, they're really not that meaningful. This is something I think I alluded to earlier in the call, but my editor like hates it if we ever include in a story this piece of technology was able to, improve, save 75% of clinicians' time, or improve revenue by 33%, whatever that percentage is. That really doesn't mean anything unless you tell me what it was before and what it is now, like
Yeah.
on a on a pretty small level, like at a specific facility or a specific health system. If you A lot of times I'm looking for specificity of like the change, what it was before and what it is now. And that's something startups have a very hard time providing, and like kind of act annoyed sometimes if you ask for, but that is the actual statistic a lot of the time that communicates that the tool is beneficial.
Interesting. That's such a good point, and I think a good reminder for all of us, because I think, we get so excited like, oh, 75% time savings, but you're right, that doesn't mean anything if you don't know what it was before or after. So I think that's a really good point. Eric or Aaron, anything else to add in terms of the kinds of data that you're often looking for, whether it's from companies or speaks to broader market trends?
I think as with AI, the value of the data coming out depends on the value of the data.
Yeah.
The surveys are great, depending on who's conducting them. Studies are great, depending on who's doing them.
Who
When I
do you
looked
like
at
to see them from? Like,
from hospitals and health systems that are conducting those studies, not from the vendors that are doing, because then that data going in is going to be skewed a little bit. It's important to know how a health system CIO, CEO, whatever, reacts to that news, and accepts that news, accepts that data as being important to him or her. So a health system that tests a new technology and produces data that says, yes, this is doing this, this is doing that, is going to have more weight for me than a vendor who comes and says, yeah, we tested this and this is what it did for us. Well, it's our data, it's our technology to begin with. So that's what's going to happen. I recently edited a colleague's story about a technology that they got a critical review in a study that came out in health fairs. And he had said, well, there were two other studies that were done that proved the value of this technology. Those two studies were done by the vendor doing that technology. That's why they were good. So you got to be careful where that data is coming from to begin with to understand the value of it at the other end.
One thing I want to circle back to that, Eric, you kind of started talking about earlier is where you identify companies that you start to follow. So you had mentioned that you like going to a bunch of industry events, and networking happy hours and all that good stuff. Is that primarily, the best way for companies to get on your radar is at those events?
I love happy.
Who doesn't?
Yeah, but beyond that, yes, I do read emails. I get them. I get tons. And that's the pitches that all come in. I can't always respond to them, but I do look at them. I do consider them all. And it's some that no, they won't work. I'll eventually forget about them. But there's so many pitches coming from so many different angles. Yeah, the exhibit hall floor is a great place. The after hours events are a great place. Emails are a great place to see what's going on in the industry. And it's really, we talk about that, how to make a pitch meaningful to me. As I said, you've got to get a hospital or health system behind it, or show me how it's being used now within healthcare, to have it resonate with me.
And Eric and Katie, you're both going to both Vive and HIMSS, which are coming up fairly quickly. Vive anyway. Presumably you're already being bombarded with pitches to meet on site. Realistically, how many executives can you meet while you're at a given show? Say you're there for 2 to 3 days. Like, how jam-packed do you make your schedule, and how do you decide which executives to prioritize?
I don't want to make it seem like I'm the model because my coworkers have commented that I'm going a little overboard, but I jam pack it, especially something like Vibe. There's so many providers. I
Mhm.
like want to make the most out of it. I like will have like every 15 minutes blocked. So
Wow.
I try to meet with like 15 to 20 execs, which again, I know like people won't want to do that, but for me, I'm not really looking to meet with startups or learn about new technology. Those are a great place for that, especially on the floor. But to me, those stories are harder to write, and a lot of other people are writing them. I'm looking for like C-suite executives at companies to comment on the industry or comment on a specific.
Mm,
I'm almost kind of like trying to find something for them to sound off about and have a sit down with them and write.
yeah.
Um, like a lot of times I write like a 700-word story on a piece of audio that was like less than 2 minutes, but it was just kind of interesting. And I caught them in a moment where they were kind of going off about something. So I, because of my editor's direction, try to focus on bigger companies or more well-known companies. At conferences like Vibe, where there's so many leaders, I just try to go after the biggest companies in my beat, try to meet with their leaders and have them comment on the industry. So that's my strategy for things like Vibe and Hymns, but it's by no means everyone's. In the media lounge, you can hear a lot of just of those informational interviews we talked about with like an early stage company, but that's usually not what I'm seeking.
Eric, you feel the same? I feel like you do jam your schedule oftentimes.
Yeah, I usually do too much
Yeah.
for it afterwards. But no, there's not going to be a major story, a feature written out of an interview at an event. Those don't happen. They're, yeah, 15, 30 minutes at the most meetings. You chat with people that you usually talk to by email or on video. It's nice to actually see people in person. Yeah, I focus on the C-suite. Yeah, I'm told to stay away from vendors, but yeah, it's still fun to talk to them and to get some of the ideas that you're going to pursue later. So a lot of the conversations, yeah, what are you seeing here? What's on your mind here? Why are you here? And then take that back and think about it and do a story on the general, what happened. But then you're thinking, okay, I'm going to do something more focused. I'm going to schedule interviews with people I did meet there to
Yeah.
get into the details that we couldn't talk about on the floor or at the
Right.
bar or whatever. So yeah, but these are events really are such social gatherings
They are. They are.
the news gathering part is kind of secondary to that, to actually meeting people and seeing people that you haven't seen in a long time, and that's where the conversation flows. That's where the ideas come from. But you got to understand, it's always going to take more than just that meeting there to
Right.
produce a good story.
100%. I want to talk a little bit about sources and specifically company spokespeople. One being, do you often want to talk to the CEO, or are you open to another member of the C-suite? Are you open to, a VP or director level? And Aaron, when we spoke last week, I thought you had a really interesting point about, you'll speak to president, but they're not always able to share as much information as you need.
Yeah. So I would say I always try and talk to the CEO, the co-founder, someone that, is really knowledgeable about the whole company, about financial piece, about, the non-financial pieces. Because like we're a financially driven newsletter. So like that's really important for us to kind of get all that financial stuff. So yeah, there's been a couple times where, the CEO was like traveling or wasn't available. So I'd have to settle for the president. And yeah, like the president knows a lot about the company, but like isn't able to speak on financials, and that's tough. That's tough for us. So yeah, I generally just try and keep it CEO level. But yeah, I think yeah.
And Katie, I feel like you had also brought up an interesting point about, you'll be pitched, say, a CEO, and then only to come to find out they're not available. Like, did that happen often?
That's happened a couple of times where a PR person will be like, I'm in scheduled an interview with our CEO to learn about this, and then they're traveling all week. That was more so I asked my coworker and another reporter, Marissa Plesh, I was doing this webinar on, for PR professionals. I asked her if she had any pet peeves that she wanted me to mention. She said that was her number one, when you offer an executive that's available and then they're traveling, which is annoying, but I understand they're very busy. So I talked to, also I'm wanting to talk to the CEO, but with a publication a little less financially driven, if I have to talk to someone else, it's usually fine. They usually don't offer anyone that's not in the C-suite, so I'll talk to whoever.
Well, I want to open it up for questions because I'm realizing we're nearing time, and I should have said at the top to chime in with questions from the audience whenever you have them. And actually we already have some, so I'll start with some of the ones that we have. Okay, this one is from Mike. What is the worst pitch you've ever received and why?
Anything that starts with "Dear Journalist."
Oh, dear
And
journalist. No
dear,
way.
right, or, something that's not personalized, really.
Yeah.
It's just, then you know that it's going out to everybody. Getting that exact same pitch.
Wow, that's pretty unbelievable. I haven't heard that one before. How about you, Aaron?
I would say I get this one pitch still to this day, probably once a month maybe, for this like clothing fashion line company. And I even got to the point where I was like, hey, please stop emailing me. This is not my beat. And they still keep emailing. So I don't know if it's like a bot or something. But yeah, that's probably the worst one because it has nothing to do with what I cover.
Oh my God. Katie, you're spared from this one because you kind of already talked about it, and we're getting a lot of questions in the chat. So I'm going to move on to the next. This one is from Aaron. What is the most exciting story you've worked on in the last 6 months?
It was kind of exciting because I spent a lot of time on it, and a lot of the people I interviewed were pretty fired up. But I wrote a story on like the M&A debate, which some people on both sides are really kind of using strong words about the other. So stories where there is like some conflict, I usually find get a lot of reads, but also are a little easier to write just because there's like, I don't know, things that have conflict that are a little more interesting, a little more clear cut to kind of understand, okay, well, they're saying this, so I'm going to go reach out back to them and see what they have to say to this. And it kind of, a lot of the mental work as a journalist is done for you just by the controversial nature of the story.
Yeah.
So, yeah, that was like a story I spent way more time on than any other story I'd probably written in like the second half of last year, but it didn't feel like it because it was interesting and a lot of that work felt intuitive.
Yep. I love that. Aaron or Eric, any other exciting stories that you've worked on as of late?
Yeah.
If nothing comes to mind, we can move on to the next. We have a lot of questions. So Kaylee says, do you need images or videos to support your articles, or does that happen internally at your publications?
Yeah, so we don't need images. We have an illustration team, which really does these like really cool creative illustrations based on the story. So yeah, sometimes people will inquire and I say no. I think the only time we actually use a photo is when we do these expert voice pieces, which is pretty much just like a high level Q&A. And we'll have the person's photo. But yeah, we have a whole like art department.
Yeah. Is that the same with you both?
I'll take a photo.
Yeah,
sorry.
yeah, with the idea that social media is such an integral part of our jobs.
Yeah.
I'm finding that I'm taping most of my interviews now so I can get images,
Oh,
video,
interesting.
so on and so forth. So it's become a point where it's not just the story; it's how you market it afterwards or how you present it. So I'm writing a story. I'm also posting something on LinkedIn and something on X and so on and so forth. The images, the videos that come with pitches are good to visualize what we're talking about.
Yeah.
But I mean, there's so
So like
much.
imagery of the technology,
Yeah,
Yeah.
yeah. There's so much that is visual nowadays. And there's
right?
so much that's presented.
That's honestly like the one thing I want to see more of from PR
Mhm.
people is images, because sometimes they offer, sometimes they don't. I usually will always, I need to post a picture along with each story. It's usually just from Getty Images.
Yeah.
But I love when like I'm writing about a piece of technology and they have, it has to be in landscape. But if they have one, yeah, I'll always use it. And I do think it really helps readers understand. It helps me understand.
Yeah, I agree. I find it very helpful.
Well, case in point, the Cedar side, they came out with AI the other day.